Okay. Good. First of all, I want to say good morning or good afternoon. We're kind of at that point where we're in between. I'll just say that when I was asked to come speak today about this topic, I began to sit down and just jot down on paper what are some of the things that I want to see in a good employee. And as I began to jot them down on paper, I noticed that I had Sarah Jane's email right beside it, and I happened to notice that a lot of the things that I was writing down are the same things that are involved in, or that are listed in their mission statement for this program. And those would be dependability, initiative, integrity, effective communication, teamwork, attendance, time management, and of course work ethics. The only thing that I would probably add to that as a healthcare worker is compassion. You have to have compassion if you're going to work in the healthcare industry and take care of patients. It's very important. How many of you, if you don't care, raise your hands, are already working in the healthcare industry in some form or fashion? And so there's quite a few of you. I would say that personally, and I actually see one of my CNAs in the crowd today, so she can attest to this, but when I'm interviewing for a CNA position on my unit, one of the things, and if that CNA candidate is actually going to school to be a nurse or work in the healthcare industry, I always say to them, one of the things that you need to remember is you're on a constant job interview, okay? And the same thing holds true for you as a student. When you're in the clinical setting, you need to remember people are watching you, okay? Potential employers are watching you. They're looking at how you present yourself. How's your attitude? What's your appearance like? What's your work ethic? What's your teamwork like? Do you jump in there and help, or do you stand back? And you know, in healthcare, we have to be a little assertive, okay? And sometimes that's not in our personality, but you kind of have to step outside your comfort zone. Sherry already spoke on it about, professionalism or dependability. Dependability is huge for us. Hospitals never close. They're there. So your patients are there 24/7. They don't take snow days. They don't take holidays. So it's very, very, very important for you to be dependable. Good dependability shows that you're committed. You're committed not only to patients, to the unit, to the facility, but you're also committed to healthcare. And you know what directors, and I'm speaking as a nursing director, but any director of in a healthcare department wants somebody who's going to be committed to the healthcare industry. You know, it doesn't just stop. Learning doesn't just stop when you finish school, when you graduate. You continue to learn. You have to be committed to, nurses have to be committed to the profession of nursing and want to give back. And, a lot of the things that we do now at Baptist, we have unit-based councils, so we have staff that are making the decisions for how things take place. So we want someone who's going to be active and involved and committed to not just our organization, but to the profession. She also spoke a little bit about communication. Communication skills are so important. I'm speaking from a nursing perspective, but another thing, I keep going back to my CNAs, but, a lot of my CNAs are in nursing school. And, one of the things I tell them is you have a leg up. you have a leg up when you enter the nursing program, because one of the things you already know how to do is deal with patients. You know how to talk to patients, and you know how to talk to family members, and that's huge. You have to be able to communicate, and then when and that's one of those soft skills, because once you know how to communicate, the things you're learning, the technical things, just start to flow naturally. One of the things also at Baptist, one of our mottos is we treat you like family. So we want our employees to treat our patients like family. We want them to be able to communicate and talk to the patients like they would their family. I always tell my nurses that I would like for them to stop and think before every shift, would I want me as a nurse today? Would I want me to take care of my patients? So whenever you do that, it sheds some light, it sets the perspective that, oh, okay, it kind of changes your attitude a little bit, because you want to present your best self, because you would want your best self taking care of you. So one of the last things I will say is I want to talk a little bit about the interview process, because you're going to go through school, and hopefully you're going to like I said, have been observed by potential employers, and you're going to come down to a time when you're ready to enter the workforce. Before you do that, you have to go through that dreaded interview process. And some tips I want you to take away today is that you want to make sure that that you realize that this is your time to shine. It's your time to show that potential employer why you're the best candidate for the job. So just a couple tips. You want to make sure you dress professionally. Always be on time. You don't want to be too early, but you definitely don't want to be too late or be late at all. And then bring a resume, even a cover letter. A lot of times that's kind of gone out the window these days. People think, I filled out that lengthy application they want me to fill out. I don't have to do a resume or a cover letter. But I can tell you, it speaks professionalism. When you walk in there with that resume or that cover letter, and even a cover letter with your resume in hand, it speaks to that employer that you're ready and that you're interested and you're putting your best foot forward. Also, and I know this is kind of cliche, but practice. Go out there, research what are some good interview questions. Ask yourself, practice in front of the mirror. I know that seems silly, but it actually helps, because sometimes you go in there and you're terrified. And it shows in the interview process. Also, you want to be confident. You don't want to be cocky, but you want to be confident. You want to know yourself backwards and forwards. You want to know your strengths, and you want to know your weaknesses. And trust me, we all have them. We all have weaknesses. The important part is being able to speak to your weaknesses. One of the things I'll never forget, as a unit director, I was interviewing a candidate for a new graduate position, and I asked her, what are some of your strengths? And she could answer that really easily. And then I asked her, what are some of your weaknesses? She sat there, she thought, and then she said, I don't really think I have any. I was like, okay, I'm marking her off the list. I'm joking, but truly, you want to know, what are your weaknesses? Everybody has weaknesses, and what are you going to do to turn that around? Everybody knows that you don't graduate and start your professional career perfect. So just be able to speak to your weaknesses and know how you're going to